to the report that we asked for on Brunswick GP services at both Brunswick Park Health Centre and also Finching the Royal Hospital. So I'd like to invite Paul Barnet.
Neil Roberts.
And Neil Roberts. Do we have
Just
Neil
Neil.
as well?
Just
Neil. Okay. I don't know whether you want to take the minutes. Sorry.
Just Neil?
And just before we invite you, sorry, I was just going to ask Mr. Hope if you'd like to come to the table. You've had a public comment, which I referred from an earlier item, and hopefully that microphone is working. And if you'd like to address the committee.
Thank you.
You've got 5 minutes, but I'm sure you'll get that. Thank you.
Thank you very much, Madam Chairman and the committee. Just wanted to briefly just put up on the record the thanks of East Barnet Association, which I'm chairman, for taking this item in your very busy agenda tonight. And thank you again the all-party support that we've had for our campaign to have the Brunswick Park Health Centre reopened after 3 years of closure. All I would like to say is that I very much appreciate the committee looking into this matter and hope that your interest in this will continue until such time as the services are restored to local residents so they are able to have the reward for all the taxpayers' money that's been spent on this resource. I have nothing more to add, Chairman. If there are any questions, I'm happy to take them, but otherwise, thank you very much.
Does the committee have any questions for Mr. Hope?
I think we probably should note the important role that the Residents Association have about keeping this on the agenda, to be perfect.
Thank you. Thank you, Mr. Hope. So, Mr. Roberts, if you would like to give us an update. I noted in the update that you sent through to us, which is on page 41 of our agenda this evening. As I said, they're both items, so I don't know, would you like to take Brunswick Park first?
Yes, we did that, Chair?
And Mr. Comment, the host, as well, and also to give us an update on the meeting.
Yes.
As mentioned in the report, which took place last night. Thank you.
Thank you, Chairman. I've given you a background to the reorganisation of the NHS and how different organisations are responsible for different parts of the system now. I shan't really go through any of that detail, because I know you would have read that. If I focus on the conversations that we had with the 2 practices yesterday, I have to say it was a constructive almost 2 hours we had with the 2 practices. Unfortunately, our colleagues in PropCo, NHS Property Services, PropCo is the euphemism they're known by, colleague was unable to be present, but we have some answers to some of the questions that we knew were being raised yesterday. We acknowledge the frustrations of the 2 practices, their frustrations of the past couple of years at least, and acknowledge that for whatever reason, the former Central London cluster of PCTs hadn't been able to conclude arrangements right at the death, so those were passed across to NHS England, the organisation I work for. We agreed yesterday a 2-track way forward. The practices were content with this. Track 1 would be my arranging with PropCo a detailed explanation of the current position they're in and a roadmap with timelines to get the practices merged, relocated to Brunswick, and the premises sold to Barnet, and those 3 things happening simultaneously. That's track 1. Track 2, which has to run at the same time, because Dr. Lucani was absolutely clear that his interest in moving to Brunswick was wholly dependent upon the sale of the premises and associated merger of the practices. And if that wasn't likely to be forthcoming, then he wanted his space back in his own premises, so that we would need to make an arrangement with Dr. Akinko to move her practice back into Brunswick on a separate time track, so we will work that up separately, but in the knowledge that if the two coincide and we can deliver track one at the same time, then that is the route we would prefer. So we have to work the two options that tries to give the two practices what they're achieving, they're looking to achieve. So that had the agreement of the two practices yesterday. I discussed this with the Chief Officer of the Clinical Commissioning Group this morning and Finchley Memorial at the same time. And he was happy that we would at least have a plan to get the thing on track and delivered. I can't sit here and give you a timeline now for when that will happen. My staff and I will be in touch with PropCo the early part of next week to get those plans discussed and agreed. Shall I pause there about Brunswick before we talk about finishing?
Yes. Councillor Cook, would you like to go first?
Thank you, Chair. Excuse my ignorance, but I'm still not clear why this delay has occurred. Is it about money? Are we in a position where it is proposed to charge the GPs more than they paid previously? And if so, why? Is it just for restitution of the services which they had before? And if that's the case, why isn't it covered by insurance? You know, why are we in this standoff? It's all clear.
Thanks, Councillor. I don't see this as standoff. I don't see this as a financial issue either. The reimbursements that the NHS make to general practice for their premises are governed by a whole set of regulations known as the premises directions, and that will dictate for us the rent that we and the associated council charges that we are able to reimburse to a practice, and they're assessed separately by the District Value Service. The thorny issue had been between the practice and PropCo was the issue of the service charge that will be levelled in the new building. What is clear to me is the footprint that the practice will occupy is larger, therefore my take is that it's not unreasonable that the service charge will therefore increase because they're occupying more space. There is something about the last point at which service charges had been levied to the practice there was 2009, we're now 2013, so just allowing for inflation and a few percent a year, it's not unreasonable to expect some increase in service charge component. And of course, the NHS in its property should properly recover its costs. And so I don't see this as a sticking point. I see this as soon as we've given the practices a sensible, detailed explanation so they can see a set of numbers that will flow from the position in 2009 through to the proposal of 2013, that I think that will be understood and accepted 100%.
Can I ask a supplementary on that? If the floor space which they are to occupy is greater than it was previously, who is saying that it should be greater? Is it the request of the GPs, or is it some part of the National Health Service is saying that's the way it needs to be? You know, was it increased by agreement? And if it was by agreement, why hasn't it happened already?
So it's down to the NHS organisation to agree the space is prepared to reimburse. That would be struck by agreement with the practice. Now, I'm slightly hampered because I haven't had sight knowledge of the detail of the last 2 years' discussion, but my experience and my practice tells me that if I'm agreeing a move of a practice into accommodation, then I am agreeing with them the square meterage they will occupy. That's a matter of form. And there, once that figure, that square meterage is agreed, it's on that basis that the system then goes out to have a district valuer's valuation of the rent that would be reimbursed. And therefore, the service charge element would be directly proportionate to the space they occupy. I'd be staggered if anybody had tried to impose increased square meterage on a practice. It's just, to my knowledge, that's just not the way it's done.
It sounds as if you've not been given the full details of what passed between the practices and your predecessor. And if that's the case, that's not a great situation, is it?
I'm desperately keen not to be worrying about what has gone on in the past. What we spent fruitfully yesterday was to acknowledge that the last 2 years hadn't delivered a solution, but we needed to find a way through it. And the practices were quite accommodating in that sense, of not wanting to trawl too much over the failings of the past couple of years. We need to find a solution together, and will. And there's a commitment to do that.
That's an intro.
Thank you. Can I ask, I understand there's currently security at the centre as it is. Can you tell me how much that's costing and who's paying for it?
Propco is paying for that, and I am not aware of what the weekly and monthly cost is.
Okay, well, I'm told it's £199 a day. I wonder if you could check that and report that back to us. I mean, part of the issue is that this seems, I think, to members of the public like a very circuitous argument. You know, the NHS pays GPs then pay Propco, and Propco end up paying the NHS again. And I think. You know, I think a lot of residents in Brunswick Park don't know why it is exactly that, you know, within the NHS there's so much probably about shoveling money around to pay for something that the whole service looks for anyway. Can you not involve senior directors in each of these areas to get a resolution for this?
Councillor, the arrangements that I have to work with are tied up in nationally negotiated contracts, which I don't negotiate. That's the Department of Health through NHS employers and the General Practice Committee of the BMA negotiate the contracts. Part of the contract are the premises directions and the way the reimbursement system works. So I readily accept that what I'm presenting to you is a money go round. It is. But it's an essential part of the money go round that enables governments to know the true cost of primary care provision, which includes the cost of their premises.
It's more than the money go round. It's becoming a merry-go-round, to be perfectly honest. I think we would all understand the constraints. I think in a council as well, we've got departments that have to pay each other for things like that. But you know, why is it so difficult apparently to get agreements and cooperation from one service area to another to get this worked out? Given it's been such a long run, it's costing the NHS as a whole a lot more than it needs to. So why is there so little interest within the NHS management for getting this?
It's a difficult one to answer because I can only answer from the first of April, unfortunately, Councillor. We have a new system in place. The estate of the NHS, where it was owned by trusts, has passed into property services, and it has its arrangements to go through for the disposal of what is a public asset. And it must follow due process right running through there. I cannot answer why North Central's Estates Department hadn't managed to complete that through the preceding 2 years. Because I have the commitment to make it work and get the practices in.
I was just going to ask, just so that we've got it straight, you were talking about the premises. I gather that although I actual structure of the place has been rebuilt as it was, that there's actually more internal space to reconfiguring it more sensibly, really. I also was under the impression, and perhaps you confirmed this, that there was room there for 5 GPs to go in there, and that there would be space not only for the 2 GPs who are interested, Dr. Carney and Okonkwo, but also 3 others. Would the service charge then be split between them? That was my question. And then also, you did mention the word sold, I think. Was that Dr. Carney is interested in actually physically buying the building? In which case then, presumably, he will sort out with the other GPs who he has in there and what service charge he will be passing on to them. Is that correct? If the building is sold to...
That's absolutely right, and that's Dr. Carney's motivation for running this through. If he can merge the practices and own the premises, he's responsible as the landlord for everything that goes on within it, and that will include the levying of the service charge to the occupants of the building, which, if the plan is achieved, is one practice. So that's just a normal running business cost. The premises reimbursements that we make for rent and rates, some of rates, would be unaffected by that because the square metre is the same. It would just be an arrangement that is reimbursing the doctor the rent. So far as the additional space is concerned, yes, there will be capacity to increase the number of patients that run through there. So if we were taking a look at potential retirement in the immediate area over the, say, 2, 3, 4 years, if we've got the practices relocated here, there is a possibility that the list will expand. That we have the capacity to expand, certainly.
Councillor Collins.
That's a promotion or not? Very worrying thought. Right, now, okay, I can see you've got the 2 traffic codes depending on whether the sale goes there. Yeah. Right, so you're from an native England, but you're covering this area. Is that why it's north and north-east?
That's
it. Covers sport right. So we've got these 2 tracks. What worries me is that you're driving one way down the track and Popcar driving the other way down the same track, and that's why it's not moving. Now, I can see why it's a bigger surgery, because yes, it allows more GPs in, but it also gives the ability for district nurses, health visitors, and other health services, and if we're trying to move things out of hospitals, you need bigger space. But I'm going to have the same with the Finishing Memorial. The difficulty is that the void space is still a cost. So even though it's empty, it's costing the NHS money. What is annoying, and I know it's not down to you, that if it had been sorted out under the, although it's North Central London, it would have been under the old Barnet PCT. That money will stay within Barnet. At the moment, if the service charge, or if it's sold, the money will go to Propco via Propco. It's taken the health service, but it goes via Propco and may not be spent within Barnet because they're a national organisation. So there is a sense that it's a lost opportunity, but we can't go back on that, and it's not your responsibility, I see that. My worry is that, do you think there is going to be some tension between Propco, who are estates management, and people who are interested in developing a primary care strategy? You know, things aren't aligned. And is that one of the problems? And if you like, is it Propco we should be lobbying to break the logjam? Is that where the problem lay? Or is that problem's unfair on it? Is that where some of the friction lay between difficulty in reaching a solution, is with how Propco's been set up?
Thank you, Councillor. I suspect that may have been the case. Let's not forget that the clusters had their own estates departments until 1st of April, so Propco's a new boy in town as well. Part of what I need to work through with Propco is about how together we deliver that strategy, which is the relocation of the practices into a set of premises that is empty, that's costing the NHS money for being empty. I'd like to think that if there is a deadlock, when I start talking with Tony Griffiths, the head chap at Propco, we will find a way to unlock it. Because unlock it we must. Because if it's a problem today with Brunswick, it will be a problem tomorrow with another set of premises, and the day after with another set.
And it will keep coming up. All I'm saying is Propco are an important partner in this, in the solution, which is why we tried to get Propco as part of what we should be talking to. Okay.
I think we've really got to move on now to the quality account. So what I was going to propose with the committee's obviously agreement and also further suggestions, that I think we've all, having heard the report this evening, the problem seems to be at the moment between Propco and NHS England. So if we could ask you, Mr. Roberts, to submit an update report, our next meeting is the 4th of July, so that we could have a report a couple of weeks before that. And also we will ask Terry Griffiths, I think you mentioned, at Propco. Tony, sorry, I beg his pardon. And Tony Griffiths at Propco to submit a report as well. And then we will bring that to the next meeting if the issue between you has not been resolved. So would you like to comment on that?
That's actually about 6th of July, isn't it?
4th of July. That if we could have the update report a good fortnight beforehand, because then it can come into our pages for the committee.
Hopefully it'll be good news.
I mean, hopefully it will be sorted. Isn't that satisfactory for the committee? Has anybody got any other suggestions? I think that really is trying to know what the sticking point is.
With your acknowledgement, Chair, what I'd like to do is speak to Tony Griffiths, and rather than giving two reports, you'll have one document.
And then if the committee, we will circulate that round the committee, if the committee feels it's appropriate, would you and also Mr. Willis like to keep the joint diary to come and speak to the committee again?
For an early slot, of course.
We will give you an early slot. Thank you. And could I also just thank all the residents here from Brunswick Park who've come this evening. And I hope this has been an informative evening for you, and that hopefully it's been constructive and that we've helped in some way move this obviously on to its, we hope, very swift conclusion now. So thank you, Mr. Roberts, for coming.
Thank you, Chairman. And I will owe you the cost of security at Brunswick.